Hey there, fellow health hunters. Ever wondered why some folks seem to have boundless energy while others battle fatigue? Or why maintaining a healthy weight can feel like an uphill battle for some? Well, the secret might just lie within a small but mighty gland nestled in your neck, the thyroid gland. Welcome to Do Remedy, Do Cure, where we're about taking you on a journey of discovery as we dive into the intricate world of thyroid troubles. Before we embark on this insightful journey, please know that all information that we share here is for educational purposes only. It is in no way meant to be a substitute for medical advice. Regarding all matters concerning your health, it is best to consult with a healthcare professional. Today, we're uncovering the mysteries of the thyroid gland, its crucial role in regulating metabolism and overall bodily functions. We'll also be shedding light on two common thyroid disorders that can truly impact our lives. Get ready to demystify hyperthyroidism and hypothyroidism in this video. Thyroid troubles, hyperthyroidism versus hypothyroidism, what you need to know. Let's set the stage. Your thyroid gland might be small, but it's a superhero when it comes to keeping your body in balance. Imagine it as a conductor of a symphony orchestra, coordinating the tempo of your metabolism, energy levels, and even your mood. Today, we're focusing our spotlight on these two key players, hyperthyroidism and hypothyroidism. These conditions, often overshadowed by their complex names, have a significant impact on the way we feel, function, and even perceive the world around us. So if you ever wondered what's causing that unexplained weight change, that persistent fatigue, or those racing heartbeats, stick around and make sure to watch until the end. We're about to dive into the world of thyroid troubles, unravel the mysteries behind these disorders, and equip you with the knowledge you need to navigate them. Let's get started. All right, let's kick things off with a closer look at hyperthyroidism, the overachiever of the thyroid world. Imagine your thyroid gland as a car engine, and in this case, hyperthyroidism is like pressing down hard on the accelerator pedal. It's all about too much thyroid hormone revving up your body's engines. So when your thyroid gland goes into overdrive, producing more thyroid hormones than your body needs, that's hyperthyroidism. This can be triggered by numerous factors like a condition called Graves' disease, where the immune system incorrectly targets the thyroid, causing it to overproduce hormones. Then there's something known as toxic nodular goiter, which is similar to having tiny thyroid flashpoints that churn out an excessive number of hormones. Then there's thyroiditis, which is an inflammation of the thyroid gland that causes a brief surge in hormone production. Now you might be wondering, what does this feel like? Imagine having your body's internal rhythm go haywire. Your heart might race like it's training for a marathon, and you might feel like you're constantly amped up with anxiety levels through the roof. Weight loss might seem like a breeze, but it's often accompanied by muscle weakness, hand tremors, and even difficulty sleeping. The hair typically feels dry and brittle, which should be a result of hair loss. Additional hyperthyroidism indicators include bulging or bulbous eyes. When you touch your neck, the thyroid glands may feel swollen or enlarged. The development of breast tissue is common in men who have hyperthyroidism. Now, if you suspect hyperthyroidism, your doctor will likely order blood tests to measure levels of the thyroid hormones TSH, T3, and T4. If those numbers are off the chart, further tests like thyroid scans and ultrasounds might be done to pinpoint the cause. The good news about hyperthyroidism is that it's curable. Your treatment options may include radioactive iodine therapy, which targets and slows down hormone production, antithyroid drugs that calm your overactive thyroid, or in some circumstances, surgery to remove a portion of the thyroid depending on the cause and severity. And don't worry, your healthcare team will keep a close eye on things to ensure you're back on track. So if you find yourself feeling like you're living life in fast forward, it might be time to check in with your doctor. Hyperthyroidism might be the reason behind the curtain of symptoms you're experiencing. But remember, you're not alone in this journey. Treatment options are available, and with the right guidance, you can find the balance once again. Now that we've explored the energetic world of hyperthyroidism, let's switch gears and delve into the realm of hypothyroidism, the steady handbrake on your thyroid engine. Picture it as if your car engine is idling too low, struggling to keep up with the demands. Hypothyroidism occurs when your thyroid gland isn't producing enough thyroid hormones to keep things humming along. This can happen due to many reasons, but one common culprit is Hashimoto's thyroiditis, where the immune system attacks and harms the thyroid tissue and area. Certain medications and conditions like iodine deficiency and prior thyroid therapies can also lead to hypothyroidism. So what does a thyroid engine running on low feel like? Imagine dragging your feet through a sand pit. Everything might slow down a notch. You might feel fatigued, chilly even in warm weather, and notice your weight creeping up despite your best efforts. Dry skin and hair might make appearances, along with a cloud of brain fog and depression. You may experience joint swelling, pain, and stiffness. Your face may appear unusually puffy or swollen. Women with hypothyroidism may experience irregular menstrual cycles. If hypothyroidism is suspected, your doctor will run blood tests to check your TSH, T3, and T4 levels. If these numbers are below an optimal range, along with considering your symptoms, a diagnosis might be made. Remember, these symptoms can overlap with other conditions, so it's crucial to discuss them openly with your healthcare provider. Chin up. Hypothyroidism, very much like hyperthyroidism, is manageable. Synthetic thyroid hormone replacement therapy is a go-to treatment and standard of care. In essence, you'll receive a synthetic form of thyroid hormones that are absent in your body. Regular doses of this medication will help restore your internal rhythm and get your engine purring again. Remember, your healthcare provider will work closely with you to find the right dosage, and it might take some fine-tuning to get things just right. But once you're on the right track, you'll likely notice those sluggish feelings gradually fading away. So if you've been feeling like you're trudging through molasses, it might be time to consider hypothyroidism as the reason behind the curtain of symptoms. With the right treatment and a supportive healthcare team, you can kick that fatigue and brain fog to the curb and embrace a more vibrant you. Now that we've explored the worlds of hyperthyroidism and hypothyroidism individually, let's put on our comparative glasses and highlight some of the key differences between these two thyroid problems. Hypothyroidism and hypothyroidism are like opposite ends of a seesaw when it comes to metabolism. With hyperthyroidism, your metabolism races, resulting in weight loss, heightened energy levels, and that feeling of being constantly on. On the flip side, hypothyroidism slows down metabolism, making weight gain more likely and leaving you feeling fatigued and sluggish. Your thyroid has a lot to say about your heart too. Hyperthyroidism can send your heart racing with an increased heart rate and palpitations. It's like your heart is attending a rock concert all day long. On the other hand, hypothyroidism can lead to elevated cholesterol levels and increase the risk of heart disease over time. Remember, while these disorders have different effects on the body, they share a common theme: the thyroid gland's role in orchestrating your overall health. But whether it's too much acceleration or not enough, the good news, as previously stated, is that both hyperthyroidism and hypothyroidism are manageable with proper medical attention. Understanding the differences between these two conditions empowers you to take charge of your health. So if you're experiencing any symptoms that resonate with what we've discussed, don't hesitate to reach out to your healthcare provider. A simple blood test can provide a lot of insight into what's happening within your thyroid engine. In our next segment, we'll dive into some practical tips and lifestyle considerations that can make your thyroid journey a smoother ride. So keep watching. Remember, taking care of your thyroid health involves teamwork between you and your healthcare provider. By learning about these conditions, you're taking a proactive step towards better well-being. Welcome to the final stretch of our journey, where we're shifting gears to focus on practical lifestyle considerations for managing thyroid troubles. Whether you're dealing with hyperthyroidism or hypothyroidism, there are steps you can take to support your thyroid and overall health. Balanced diet. Fueling your body with a balanced diet is like giving your thyroid the right tools to do its job. Incorporate foods rich in iodine, selenium, and zinc, nutrients that play a role in thyroid function. Foods like fish, dairy products, whole grains, nuts, and seeds can be great additions to your plate. Stress management. Stress can throw a wrench into your thyroid harmony. Engage in relaxation techniques like meditation, yoga, or deep breathing exercises to keep stress levels in check. Adequate sleep can also play a vital role in maintaining your thyroid's equilibrium. Medication adherence. For those on thyroid hormone replacement therapy, consistency is key. Take your prescribed medications as directed by your healthcare provider. Regular follow-up appointments are essential to monitor your progress and make any necessary adjustments. Stay hydrated. Hydration is crucial for every cell in your body, including those thyroid cells. Make sure to drink enough water throughout the day to keep your body functioning optimally. And there you have it, a whirlwind tour of hyperthyroidism and hypothyroidism, two sides of the thyroid coin that can profoundly impact our well-being. Remember, you're not alone in this journey. If you suspect thyroid troubles, whether it's racing too fast or taking things too slow, reaching out to a healthcare professional is your first step towards finding the right solution. Knowledge is power, and armed with the understanding of these conditions, you're better equipped to navigate the twists and turns of your health. If you found this video helpful, don't forget to subscribe and hit that like button and leave a comment. Stay healthy, stay informed, and take care of your incredible thyroid engine. I'll see you in the next video.